back to another session of Stay Connected with the Worcester Senior Center and me, your kind of intermittent host, Mike Hirsch. I'm the director of the medical director of the Department of Public Health, as well as the Chief Pandemic Information Officer for the City of Worcester. And you all have been a wonderfully loyal audience over the last year and a half as we've kind of navigated this horrible pandemic that never seems to end, right? So we've just gotten past the Christmas and New Year's holiday, and here we are in the midst of an Omicron variant surge, just as the Delta surge was really sinking in, and our case numbers have really been high. And we're expecting them to go higher because of the bump that we always see after the family gatherings that we have around the holidays. I think everyone is struggling with the fact that, you know, we didn't want to have the community locked down. We didn't want to go back to virtual work and virtual school and virtual college. We really tried to figure out a way to live through this surge, and I'm not sure which way things are going to go yet. I think that there's going to be a lot of soul searching over the next month or so, because we're still in for a very rocky month of January into February, seeing what all the travel that we did for the holidays and gatherings have led to. The cases that we're seeing, though, fortunately, have been less severe. And that's because more and more people have been heeding our plea to get vaccinated, and if you're vaccinated, to get a booster. The booster has been shown very clearly to give you extra levels of protection, both against Delta and Omicron. Omicron is a variant that came to us essentially from South Africa with over 50 mutations in the spike protein. If you remember, the spike protein is the one, when you see these illustrations of the coronavirus, the spike protein are those little projections coming off of the sphere that represents the virus. And it's the spike protein that we have used the vaccine to train our immune systems to attack. So in the case of the original variant that the vaccine was designed against, the Alpha variant, the spike protein was the point of attack, and the vaccines did a great job against that. So we saw, after we started to administer the vaccinations in January and February of 2021, just a year ago, the numbers showed that we really saw a decrease in the cases of COVID-19. But then Delta appeared. Delta came from India. Always these bad variants seem to come from under-vaccinated parts of the world. And India and South Africa were both like that. So the Delta showed up sometime in June, and suddenly we saw the numbers creeping up. And if you've been watching me on your show this time, in these shows, you'll know that I've been nervous about Delta for a long time. And especially once the cold weather came and once we were all going to be indoors and not going to be able to do our restaurant dining outside or our gatherings outside, and we had to come inside, that's when we started to see the case numbers shoot up. And we've been having some very high case numbers here in Worcester. We've been urging people to try to get their boosters, because a lot of the susceptibility to Delta has been because the original vaccinations we gave you in January, February, March are kind of wearing off, and your level of immunity is down. Within 48 hours of getting your booster, you can get that level of immunity back up to almost 100%. So it's not like when you get your booster, you have to wait a month before it really takes effect. It takes effect almost immediately, and it gets to very, very high levels of immunity. So we thought, okay, great. Now it looks like Delta really can be fought with a booster shot. Then comes Omicron. Omicron from South Africa. It has a doubling time of 48 hours. So every 2 days, it doubles the number of people that it infects. It doubles the amount of virus that's in your body. And it spreads so fast that even in vaccinated people, you can develop very high levels of Omicron. Usually, it doesn't get into the lower part of your airways like Delta did. Delta could go way down into the deeper part of your lungs. Omicron seems to stay in your nasal passages and some of the upper airway stuff. That's why it doesn't seem to be causing as severe cases. But in the unvaccinated, it does cause severe cases. And what we're really facing right now is a hospital system, not just here in Worcester, but everywhere around the country, that is being overwhelmed. It's overwhelmed for about 5 different reasons. Number one is that we were seeing a lot of delayed presentations of serious illnesses from people who had been avoiding coming into the hospital. Maybe they were avoiding it because they didn't want to expose themselves to COVID. Maybe they were avoiding it because they were just hoping that some of their symptoms were related to COVID. We don't know. But there have been a lot of delayed presentations of heart disease, of different types of gastrointestinal disease, of cancers, and that's clogged up the hospital system. Now with more COVID cases on top of that, it's even more clogged up. Here in Worcester, we had a severe bed shortage in the city because St. Vincent's had been on strike. Now that the strike is settled, that should ease up some. But we don't have the same mitigations going as we did last winter when we had the DCU Center open as a field hospital, and we had the Beaumont Center on Plantation Street as a convalescent home for COVID-positive elderly people. So without those type of pop-off valves, the hospitals can get very, very crowded very quickly, and bed availability is bad. What is good is we have the protection, the PPE is in great supply. We have a lot more ways of treating people with COVID once they get it. We have pills that they can take. We have antivirals they can take. They can get monoclonal antibodies. And we are much better with the ventilatory support that we do if you end up on a ventilator. So the mortality rate should be lower. But if Omicron causes so many cases, even with the actual rate of mortality being lower, the sheer number of cases in the ICU and cases in the morgue will go up. So it's a very tricky time, and everybody's tired. And that's another reason that we're facing problems, is because you may have heard of this term, the Great Resignation. The Great Resignation meant that many people that were essential workers, that were workers in long-term care facilities, that were workers as home health aides, that were workers as visiting nurses, these people have decided to leave the workforce because of various reasons. They didn't feel that their monetary support was enough. They didn't feel that the risk of getting COVID made it worth them working. They didn't feel that they needed to be exposed. Whatever the reason, it's very hard to get people into nursing homes. It's very hard to get people into rehab centers. It's very hard to get people home health aides and visiting nurse services, so that people languish in the hospital as inpatients longer. All of these factors are leading to a crisis in healthcare. So, what were the solutions that were proposed? Well, more and more cities you're going to see are going to come up with vaccination passports. What does that mean? Like in New York City, in Los Angeles, in Chicago, to go to a store, to go to a concert, to go to a restaurant or a bar, you have to show that you've been vaccinated. I think also the definition of fully vaccinated is going to change, so that if you don't have your booster, you're not going to be considered fully vaccinated. The other thing that is being proposed in many places is vaccine mandates of employers. Employers are going to say, I want my workforce all vaccinated. If we don't have them all vaccinated, they may have an opt-out to instead get tested once or twice a week. But if they don't comply with any of that, they may be terminated. The city here of Worcester has a vaccine mandate. UMass Medical Center has a vaccine mandate. St. Vincent's Hospital has a vaccine mandate. They're not the most popular things in the world, but they work in terms of getting the percentage of people in your workforce vaccinated, no question. They're way up there. On college campuses, there's a vaccine mandate. They have vaccination rates of 98%. So they have outbreaks. These are called breakthrough cases because these are students that have been vaccinated. They're getting COVID anyway, but they're mild cases. They're not all running to the hospital. They go to student health. They get told to stay in their room. They get arrangements made to have food delivered to their room. They work remotely. They can stay. Even in our public schools, we're doing a test and stay situation where if a student has been exposed to the virus, we're keeping them in school and testing them 5 straight days to see whether or not they develop symptoms or they develop a positive test. And that's kept a lot of kids in school that ordinarily would have been sent home last year. And everybody knows that the mental health problems that we've sustained from not having children in school where they can be socialized has been a terrible drain on the system. We have kids in UMass's emergency room, children with mental health issues that are staying there for weeks because there's no mental health beds available in the Commonwealth. This is really a pandemic that has exposed a lot of holes in our system. And we're obviously going to have to work on them once we are past it. So how are we going to get past it? One of the things I think that's a really great way of getting past this is this thing. This is a home test that you can do that will tell you whether you're positive or negative. So let's say you got a call from one of your nieces or nephews who visited you last month. I have COVID. I'm worried that you might have COVID. This is the way you can test yourself and see whether or not you need to take special precautions called quarantine or isolation. Quarantine is if you're a contact to somebody that's been exposed, and isolation is if you actually have a positive test yourself. These are very simple kits, and the Governor Baker's administration, just before the holidays, gave Worcester 150,000 kits to give out. And we've given them out by distributing them to all of our community partner agencies. So churches have gotten them. The YMCA has gotten them. The YWCA has gotten them. United Way of Central Massachusetts has gotten them. The Senior Center has gotten them. We've decided not to give them out to individual patients, but instead to these organizations so that they can actually get them where they're going to hang out. and they're very, very good, simple tests. There's 2 in a box, and I'm just going to show you what they have inside. 2 sets of everything I'm showing you. There's a liquid that is very important. That's the thing that reacts to your nostril secretions. You're going to take that liquid and you're going to put it right on this test card. 3 drops of this liquid goes in this little hole, right? Then what you're going to do is you're going to swab your nose, and you do this with this swab that's included in the kit. It's like a Q-tip, right? And you're going to put it in your nostril, and you're going to turn it around inside your nostril 3 times. And then you do the same on the other side, okay? So after you put your 3 drops in there, you're going to then insert this Q-tip into the hole that's provided here by the kit. And when you do that, you're going to see whether 1 or 2 lines appears in this window. If you have 2 lines in 15 minutes, you have COVID. If you have only 1 line, you don't. This is, I think, our true ticket out of prisoner life under COVID. If we have a little cold one morning, test ourselves. Test yourself. If you have 2 lines, you're not going anywhere. If you don't, you can go somewhere. This is 80% reliable, at least 80% reliable. It's called an antigen test. It's not as sensitive as the PCR test, but it is pretty darn close. And so if you get the call again that you were with somebody who had COVID and you want to check whether you had COVID, it takes about 5 days for COVID to incubate. So if you get the call that somebody who had COVID yesterday was with you yesterday, you don't have to test that day because it's likely that that test is not useful. You have to wait a few days and get your test on somewhere between the 4th and the 5th day after your exposure. And if you've tested positive, then you can be out and about. Until that time, you have to do something called quarantining. Quarantining means you have to not be with your housemates, not be with your family. Your family needs to provide for you a way of getting your food, getting your drink, and going to the bathroom in a separate way from the rest of you. And if you're having trouble with these instructions that I'm giving you, we have this all very clearly written out on the www.worcesterma.gov health site. You'll see it there, and it's available in 6 different languages. So I think that this is a really great thing that we've been able to distribute all of these kits around the Worcester area. Now, the federal government is about to deliver the similar kind of kit by going on their federal website. You'll be able to order up a test, and it will be delivered to you in the mail. This is, I think, how we're going to go moving forward. We're going to need to have testing that will allow us to know whether we can attend certain congregant activities, whether we can go to school, go to work, go to the senior center. These are the things that we need to do to give us more freedom, because knowledge is power. You can't cower and say, oh, I have a little sniffle, I don't know what it really is. This will tell you what it really is. If it's just a routine cold, if it's the flu, and we'll come back to the flu in a minute, that's something that we're not as concerned about. Now, the backup system for all of this is the mask. I'm not wearing one now because I'm all by myself in the studio here, but whenever you're in a situation where you can't distance more than 6 feet and you're indoors, you got to wear a mask. And the mask should be a good mask, one that is not like been used for days and days and days. And they're very, very available. Stores are providing them, and you should make sure that you're a stickler about wearing them, particularly indoors. Outdoors, you're okay so long as you're not, shoulder to shoulder with 1,000 screaming fans at a Patriots game. I would wear my mask in that situation anyway. And it's so darn cold now, when you go to those outdoor situations, the mask actually keeps you a little warm too. So that's a side benefit. So let me talk a little bit about the flu. Flu season is here. Flu season last year was very, very diminished. Why? Because we were all wearing masks. But now people have gotten tired of the mask. They say to themselves, I'm fully vaccinated and I have a booster. I don't need a mask. I think that the mask will keep the flu out of your life as well. And, every year 30,000 people die of the flu. It's a lot less than what we've experiencing with COVID. COVID right now, rates of death every day in the United States, 1,200 people are dying. That's just way too high for us to be satisfied that this is the new normal. It's not the new normal. The new normal is going to come, and I don't know if Omicron is this variant, but a variant will come of COVID that is like the common cold. And we won't be as afraid of it, and we won't be testing, and we won't be going crazy. And we will find that every year some variant will come along of COVID that we will get a booster shot once a year, like we do with the flu. And the brilliant scientists at the NIH and the CDC will try to determine what's the likeliest variant that they need to protect against. And I think that's when we will find a new normal, where we'll all live with this without fear. But we're not quite there yet. And certainly over the next 6 weeks, we are still in a heap of trouble, because there are still about 25% of the population that is not vaccinated. That's a real shame. And the resistance to vaccination is still there. This should not be political. This is all about science. This is all about factual science, not the kind of science that you get on Facebook and Twitter and TikTok and Instagram. It's got to come from the CDC. It's got to come from the NIH. It's got to come from trusted people at the various schools of public health in your area. We are very lucky to have the T.F. Chan School at Harvard. We have a School of Public Health at UMass. All of these places are giving us the best data possible. And we're trying our best to give you the best information from those schools. There's a lot of criticism about how, gee, Dr. Hirsch, you said one thing a month ago and now you're saying something different. Yeah, I don't think I can be held totally accountable for that, because the virus is mutating. And it's mutating because people are not getting vaccinated. The unvaccinated are allowing mutations to occur that will unfortunately resist the vaccine. And that's why this thing keeps perpetuating. It's unbelievable to think that 50 million people in the United States have had COVID, and that 800,000 of them have died. 1 in 7 people in the Wu area, in Worcester County, have had the disease, and 1 in 330 have died. That's an enormous number, and it shouldn't have happened that way, because when we first rolled out the vaccinations in January of 2021, I never would have thought there would be a problem with under vaccination because everybody wanted it. Everybody was calling and complaining, I can't get it, I can't get it, I want it, I want it, I want it. Everybody knew that was the ticket out. But somewhere along the way, some very, very misleading information got out there that somehow the vaccine wasn't safe, that it wasn't vetted correctly, that it had all different kind of components in it that were weird, and that led a bunch of people to become very firmly against vaccination. I think we've gotten over that because I see the lines now all through the holiday season of people lining up at our vaccine clinics. We've had hundreds here in the WU. And thanks to Dr. Castile and Karen Clark, who's our director of the Department of Public Health, our public health nurses led by Pat Bruckman and Amelia Houghton, and really the city manager and the mayor, we have stood up so many clinics. Again, the Vaccine Corps from UMass Medical School, tremendous efforts to get us vaccinated. And finally, I think people at the end of December were starting to take advantage of it. And I hope that continues into January. But again, and I told you this the last time we spoke, as elders in your family, you are the trusted, wise people. You are the ones that your family goes to for advice, for counsel, for comfort. The best thing you can do for your community and for your family is to tell anyone in your family who's not vaccinated, get vaccinated. Anyone in your family who doesn't have a booster, get a booster. Anyone in your family who has kids between 5 and 11 or 12 and 16 who haven't been vaccinated, get those kids vaccinated. Don't hesitate to be confident to recommend those things. If they listen to you, it's much better than hearing it from me. I know that you can help us in this campaign to get the WU safe. We've gotten our levels of vaccination to about 60%. That still means 40% of our community here in Worcester is not vaccinated. That's too high. The rest of the country, the rest of the Commonwealth, is about 10 clicks ahead of us. 70 to 75% of the country is vaccinated. We're 10 to 15 points behind that. And that's a reflection of hesitancy. It's a reflection of anti-vaccination politics. And I don't think it's from lack of effort of all the community partners we've had trying to promote vaccination, but I know that we could do better. And I think maybe finally the word started to sink in as the Omicron threat came around in the middle of December. Maybe people are listening now. So I know sometimes after the holidays, it's a little blue period, right? Either you had your gatherings for Christmas and New Year's, or you decided to be ultra safe, you weren't going to have those gatherings. It's gloomy, it's gray outside, it may be precipitating and making you all feel a little bit isolated. This is a time, very important time, for us to recognize that the health of Worcester is at stake. If we want to have a spring that's like a new birth, I think that getting us all vaccinated, getting us all boosterized, keeping with the masks, and making sure moving forward that if you're going to go to gatherings, if you're going to go to congregant activities, whether it's church or another family gathering that you're deciding to delay from December to what you think might be a safer time in January and February, use these kits. This is going to help us a lot. We don't have the contact tracing going on that we used to. We are finding a lot of healthcare workers are leaving the healthcare workforce. The hospitals, may become flooded, and we just can't afford to add to this situation by being negligent on our own health. We have the power to avoid those kind of catastrophic problems with no beds and needing to reopen centers like the DCU and potentially even shutting hospitals down for anything other than COVID. We've already stopped doing elective procedures as the state has recommended. So surgeries are getting delayed, and we're going to find again, like we were this past fall, a lot of people are delaying their health care, and they're going to be much sicker when they finally get attention again. We've got to stop this cycle. So I just wanted to say to all of you, I think 2022 is going to be a better year. It's going to take us through the winter season to get to the good part of the year. We will get there with your help. We will get there together, and you've just got to keep abreast of all of the changing information that comes in. So we're going to be there with press conferences, with press releases, with lots of public information of how you can best handle things, and you're not alone. If you have questions, you can always reach us on our health line, always reach us through the website, and I would urge you to take advantage of the experts that are at the Worcester Senior Center too. We have one of our public health nurses having a clinic up there. Amelia Houghton is an enormously intelligent and full of information public health nurse. So I thank you for letting me bend your ear today. I am going to tell you one little story, because I usually tell you a story, right, as we speak here. I think a lot about history whenever I'm, trying to contemplate how bad are things really now compared to other times in history. And I think about January of any year in terms of the Battle of the Bulge, because this is kind of our Battle of the Bulge. This is our country's healthcare Battle of the Bulge. Battle of the Bulge was fought in 1944. December 16th, the German army staged a very unexpected push against our front lines. They were in full retreat after our invading France and liberating Paris, and it looked like we were just settling in for the winter. Then in the spring we were going to roll right into Germany and free Germany from Nazi rule. But the Germans had one last-ditch effort to thwart that plan. So they started pushing back on our lines, and they made such a push that the shape of our line bowed in such a way that they called that the bulge. That's why this battle was called the Battle of the Bulge. And it was fought by understaffed, clothed, poorly supplied GIs in the U.S. Army that were in many cases surrounded by very well-supplied German army. And it looked for a long time like the Germans would cut our lines in two and potentially make their way to the sea in Antwerp, and potentially then force us to start a negotiation of peace with the Nazi government. But what made everybody successful in beating back the bulge was just sheer grit and determination of the GIs. They were in cold foxholes, wearing summer issue clothing. They didn't have the proper boots. They didn't have the proper coats. They didn't have the proper weapons. They didn't have enough ammunition. They were sitting there, putting themselves totally on the line to fight back the bulge. And they did it. It took them a solid 5 weeks of fighting, but they beat back the German army. And we can do that kind of thing with this virus. We can win against COVID, but we have to show that same level of determination and grit and the overall feeling that failure is not an option. We can't give into this virus. We can't allow this to kill more people. 800,000 deaths is just an enormous hit. There's almost no family that hasn't been affected by COVID. And we've got to really fight back. So let's be strong. Your generation knows this better than anybody else. Let's be strong. Let's have faith that we can do this, and we will. So I will see you again next month, hopefully with better news. And I thank you all for listening. Be safe, and don't forget, use your kits to figure out what you can and can't do in order to be part of society again. We're going to have to live through this, not hide from it. Thanks.